Good morning, everyone, and welcome to another great webinar with Messer Financial Group. We're very fortunate today to have our good friend Missy Ferguson with us from BlueCross BlueShield of South Carolina. She's going to take us on a whirlwind tour of South Carolina and the plans that are available this year on the exchange so that we can better serve our clients. We've broken down the state, as many of you well know, into the upstate, the Midlands, coastal region, and we'll close out with the PD today, as we've had some concerns and questions about that particular area that we'll hope to address today. But again, we're really excited to have Missy with us. Just a few reminders. There still is some time to contract, if you haven't done so, with Messer Financial for BlueCross and BlueShield of South Carolina. You'll need to log in to your SureLC account or create one with us and request that, and we'll get that processed and off to the carrier as soon as possible. To expedite that, we would ask that you make sure that you have completed your FFM certification for the 2020 plan year. If you have any additional questions, please reach out to us here at the office at 866-568-9649 and ask to speak to someone in producer support, and we'll get you on the right track for getting everything you need to have a successful OEP this year on the under 65 market. So with that, I'm going to turn it over to my good friend Missy Ferguson, and we'll get started. Missy, take it away.
Thanks, Jeff. Hi, guys. I'm sure I know plenty of you on this webinar. I am Missy Ferguson. I handle the Midlands, Rock Hill, Lancaster, Charlotte, North Carolina areas. And later in the presentation, if you are not in one of those areas, we have marketing support all over the state. So there are 3 other reps that do exactly what I do, and I will give you all their contact information, what counties they service, because with BlueCross, we value our agents, and we have reps out in the field here to serve you. So today we're going to go over a little bit why to choose BlueCross BlueShield of South Carolina for your 2020 plan needs. Well, for the past several years, as you all know, it's been somewhat smooth sailing. There was only one option, and BlueCross has been an option since the inception of ACA. We have remained on the federal marketplace from the get-go. Then some carriers left, and we still were there, and now we have some competition coming back into the market. We're going to go over who that competition is, some of the information that we have learned about that competition. We're going to go over some selling strategies with BlueCross. We're going to touch on where there may be some disruption in the state due to some rate filings by one of the carriers. And then we're going to close it out with why sell Blue. So without further ado, let's get started. Some of you and I have been in agent meetings where some agents knew and some agents didn't know that we were going to have these 3 new carriers. Well, actually, Centene or Ambetter was in the Charleston area last year, but they didn't make much of a presence. This year, they have expanded their county. They are an HMO carrier, and their main target market, as you can see when we go over rate examples, later on in the presentation, is at the 250% and below federal poverty level. Again, they're in 12 counties, and we will review a map that goes over all of those counties. They are offering 14 plans, 2 gold, 9 silver, and 3 bronze. One thing that's really important to point out here is while a lot of our state does qualify for subsidy, there is a large percentage that does not. So Ambetter is not an option for people who want to go on the private marketplace. Molina, too, is an HMO carrier. Their target market is below 150% of federal poverty level, and their network also is limited for 2020. They have come into 20 counties, and again, we'll touch on that in a map in a few minutes. And as you can see, they have the 8 plans, 2 gold, 3 silver, and 3 bronze. And they, too, do not offer any private marketplace plans. They are on the federal marketplace only. One thing that I do want to point out with Molina is they are handling all of their service with their Medicaid line. They are in the Medicaid market, as some of you may have heard, and that line has a customer service rating of a 1. So I just wanted to point that out with you, from the get-go, so you can know some of the history and background that we have researched and learned. Also want to point out to you guys that with these two HMO carriers, if you do not have a primary care provider, one will be provided for you, and you will not be able to change that provider for a minimum of 30 days. So that is something that is not how the Blue plans work. You can go to your primary care provider of your choosing, and we will not assign one for you. So that is a big difference that I want to point out, when discussing these plans. In the upstate, as some of you have heard, we have Bright Health. They are in the Greenville area. We had thought that they would come into more than just 3 counties, but for 2020, it is 3 counties. They have a limited network, 8 plans, 1 gold, 9 silver, and 3 bronze. This is the only one of the new competition that will offer 1 private marketplace plan. So 1 plan that is off the marketplace. I know that Molina and with Ambetter, they are promoting, for agents to go in and enroll members through Health Sherpa. I do want to point out, that Health Sherpa, if you stop using the Health Sherpa platform, that we reviewed their business associate agreement, and they have the right, if you stop using their platform, to market to your clients. So that is one thing that we feel that we need to point out to you. Whereas if you use the BlueCross quoting engine and enrollment platform, or some of the other clouds that are out there, your clients are kept secure. Okay, here is our county map. And there is one area right here that is not, Pickens needs to be highlighted for Bright Health. I apologize, that map was to have been corrected, and I did not get the update before this morning's webinar because all of this is some new information for us, so I apologize. But one thing I really want to point out to you guys is in the white areas, that is the 14 counties that BlueCross is the only competitor. They are the only carrier in the 14 counties. So Richland, Sumter, as you can see, up to Spartanburg, Greenwood, Abbeville. So, there is only one option for members there. Then in the pink area, we have Molina in the market. Like I said from the previous slide, they're in those 20 counties. They are in Lexington. I do want to add to all you guys out there, I know it has been a tough few years with ACA because those Lexington medical patients are very true to Lexington hospital system. And we've tried for years to get them in network, and they will be in our ACA network for 2020. So that is great news. We see a lot of potential for expansion in the Lexington area because we've seen in the past with them not in network that some people would just go uninsured and work out a payment arrangement. So that is great news for the Lexington area. Centene, as you can see, is in the green counties. And Centene and Molina as a combination are in the 3 purple counties. So we're going to go over a little more in detail in the next few maps, and we're going to go over some rating examples around these areas on what the pricing impact will have. This is a great map right here for BlueCross. This, of course, is where BlueCross has the lowest second cost silver plan on the 2020 individual exchange. Now, why is the second lowest cost silver plan an important thing to be on the federal marketplace? And we've known this for years. It is because the second lowest cost silver plan determines what the subsidy amount will be for the upcoming year. So in these counties, the dark blue, of course, are the ones that we are the only competitor in, and the light blue are the ones where we are the second lowest cost competitor. So as you see, and I just mentioned Lexington is one of those counties. So this is great news for these counties. We do not anticipate seeing any at all disruption from our membership area. There are, in the next few slides, a few areas that we are going to see, some differences, and agents are going to have to begin, being creative with plan design, as well as, comparing competitor A versus competitor B versus BlueCross. And we'll touch on that in the next few slides as well. Right here is another great map. I don't know how many of you on the call sold our zero premium bronze last year, but it was our fastest growing, adding close to 30,000 members to BlueCross BlueShield of South Carolina last year. We are comparing our bronze 4, which is not our lowest cost bronze, to all of the other carriers' lowest cost bronze plans. Look at all that blue. Blue is still the lowest cost with the bronze 4 in all of those counties. As you can see, in the red counties, there isn't as large of a difference in rate differential. But again, we're referring to the bronze 4 that has the primary care copays, has the prescription drug coverage, to the competitor's lowest cost bronze that doesn't have those benefits built in. So again, you're going to have to compare your plan designs when you're looking at price and benefit in some of these areas. Where BlueCross anticipates seeing a good bit of, research or transfer in membership is in the Florence and Marion area, as you can see highlighted in the pink. Ambetter came in with a very low rate filing in that area, which then in turn made the subsidy amount for all the members in Florence and Marion to go down significantly. So while they filed a rate decrease, it didn't mean their premium would go down, because their subsidy went down as well. So if you've been out there looking and quoting out there on the FSM, I'm sure you have seen this. Here, and I apologize for all the, charts and things, but it's the only way basically to break it down, price by price, carrier by carrier. In the Charleston County area, where you did see a difference in, percentage difference in premiums, Molina and Charleston was the second lowest cost silver plan. And their second lowest cost silver plan came in at 16% lower than BlueCross's silver plan. So what does that do to premium? Okay, I'm just going to start because Molina focuses that mainly, they're the most competitive in the 150% federal poverty level when looking at plan benefit differences. Today, if you have with BlueCross someone on our lowest cost silver plan at age 25 in Charleston, that member, their cost is $62.98. Based on the filings for 2020, that same lowest cost silver plan with BlueCross will go up to $120.79. However, in 2019, if they had the bronze plan, it was a zero premium. And so the bronze 4 in 2020 will remain a zero premium. So, why, and we're going to go over this in further slides. Yes, this is a difference, on the silver plans of about $60, and that is a big impact on the 150% of federal poverty level line of business. They still have the option of getting, if they can't afford the $64 that Molina charges, or if they can't afford the $120.79 for the BlueCross Blue plan, they still have the option of the zero premium bronze. But remember, when comparing these plans, we're going to have to compare out-of-pocket costs, and we are going to have to compare co-insurance and RX formularies, because there are some very big differences there, as well as in network. There are a lot of gaps in these competitors' networks that are new to the market. With each of your clients, look up their doctors, look up the hospitals, because that too is going to be key in enrolling in 2020. We'll take it down one to Charleston person, age 55, and the 200% of federal poverty level. Their blue plan goes from 132 to 260. That is about a 50% increase in premium level. Again, subsidy is based on the second lowest cost silver plan, and Molina was that plan in Charleston County, so it adjusted the subsidies that people would receive. They, at 200% of federal poverty level, if they were on a zero premium bronze, they still will be able to get the zero premium bronze, or they could look at the Molina option, not have all hospitals in network, and pay the $135. And as you can see, the further, down that we go, you can see the rates are narrowing. So that is one of our outliers, is in the Charleston County area. But as an agent, you all are seasoned. You will see in the upcoming slides differences, in benefits, differences in networks, because ultimately these members are going to want to be able to utilize their health insurance coverage. Okay, Greenville County, it is not quite as drastic and different as Charleston. We do feel that we will see some movement in Charleston. However, they don't have Roper Hospital. Again, go in and look at those networks, because that is a very Blue has every hospital in the state now, and there's no out-of-network coverage with these HMO carriers. So if you wanted to go to Columbia to Prisma Health, they're not in their network, you don't have the option to do that. So remember, keep that in mind with those HMO carriers. Greenville County example, if you look at a 25-year-old at 200% of federal poverty level, they've got $130 premium this year. They're going up to $148 premium in 2020. The bronze, they could get the 2019 bronze 4 member at 200% federal poverty level, could receive the bronze 4 plan at $1.50. This year it's going up $15.99. Yes, that is a difference. But might I touch on the network in this area? The network in Greenville County does not include Greenville Hospital System, which has recently been bought out by Prisma Health, which is also here in the Midlands. It includes ANMed and St. Francis. That is your Bright Health network in the upstate. So would you want a member to pay $10 more, $13 more in premium for a silver plan, or have primary care copays and go with a bronze plan and save money if they were on silver and be able to see their doctors? That is a huge point to point out with these limited networks, because the first person they're going to call when they go to their doctor and their doctor says, well, we don't accept Bright, they're going to call the agent. So we're going to have to do a lot of educating with all of this. Some say disruption, I say change in the market. But again, if you look down at your 55-year-old, you can still qualify for a zero premium bronze up to 250% of federal poverty level. Their silver plan last year went from 206 at 250% of federal poverty level up to 244.89. And then Bright Health, with their second lowest cost silver, is at $215.71. But again, you can only go to those two hospitals with the two, with their network of doctors. And Greenville Hospital System is also now known as Prisma Health, is the largest provider and hospital in that area, as well as the most utilized. So not a whole lot of difference in premium here based on benefit and network, and we will show where, yes, it may be $10 more to go with Blue, but if you look at the plan beside their plan, at the end of the day, you're paying more in out of pocket than you are saving in premium. So we'll go over that as well. And I know most of my seasoned agents understand that. And any of the new agents, I know that Messer Financial or your Blue Cross marketing representative are happy to come in. I know it's our busy time, but, we are told to be on the road 5 days a week during open enrollment and sometimes 6. So we are more than happy to come out and kind of show you these examples and go over a little more one-on-one. But I wanted to just give you a broad view on how it's impacting what their current premium was, what their current premium is, since we, of course, were the only carrier in the market for 2019, and what their options can be in 2020. Okay. As I mentioned earlier, Florence County and Marion County are going to see a lot of upturn or upshake in the membership there, because the second lowest cost silver plan was filed by Ambetter or Centene, as some of you refer to it. It's either or. It depends on the day which one I say. But they were the second lowest cost silver in these areas. They undershot Blue Cross's rate by, on average, 47%. A lot of people would say, that's great news. That's just great. Insurance premiums are lowering. And Blue Cross filed for a 3.9% rate decrease this year, and we got that on our policies. But a 47% rate cut really is going to affect our subsidized members, because the subsidy levels are being reduced because of such a low premium rate filing in the Florence-Marion area. One thing that's important to note before I go over this slide, last year the state of South Carolina was one of a few, maybe a handful of states who increased membership in the ACA population. One of maybe 3 or 4 states, actually. And a lot of that was due to the zero bronze. We saw a large gain in membership because people just simply couldn't afford $60 a month for their health insurance. But why not go out and get a $0 bronze with primary care copays, prescription drug copays? So we saw an increase in membership. Now with this decrease in subsidy, let me walk you through how this example works. Let's start. We'll start, and I'm sorry, these numbers are so small, and shortly, after the presentation's over, we'll be able to disperse some of these slides to you guys. But I just wanted to show you the impact of these rates to members. Mind you, a lot in this population was, and I'm waiting on a final number of how many were zero premium bronze in Florence and Marion, and I can circle back with that. But at 150% of federal poverty level, 2019, your lowest cost silver members cost was $60.86. But the majority of our membership, we saw the uptick in the zero premium bronze for 2019. Well, in 2020, that lowest cost silver is going up to $205.83. Okay? Remember, we had a large uptick in the bronze market because they could not afford the $60 silver premium and that 150% of federal poverty level. Well, look at based on what subsidy is given to members, look at what the bronze plan went up to in 2020, $61.64. And if you look at Centene, their second lowest cost silver plan, for the members' cost, it's in the $60 range. It's $64.32. So all of those that were gained last year in the zero bronze level, if they can, wing it, they have the option of the bronze 4, which does have McLeod in network at $61.64, or they can go with Ambetter or Centene for $64.32, who does not have McLeod in network. So they can have the coverage with Ambetter, they can have the coverage with Blue Cross, but the most utilized hospital and network of providers, doctors in that area is McLeod, and it is not in their network for 2020. Go down another line, zero bronze went to $132.41. The lowest cost silver member for Centene who can't use McLeod Hospital is $135.10. So there's a big difference in what members were paying in 2019 and what they will be paying in 2020 based on the filings that were cut so low at a 47% federal poverty level. I'm not saying, don't show your client all the options. Of course, competition is a good thing, but they need to know what doctors they can see, what medications they are covered, and we will go over a few of those examples in just a few minutes. Horry County examples. This one is not as different as Florence, and Florence was supposed to be the last slide we did. I apologize, but I got the shocker counties to you before Horry County. Florence and Marion, again, are where we are going to see the most disruption or member movement, simply because some can't afford a $60 increase in premium, or some don't want to not go to their providers like we have seen in the past in the Lexington area. So in Horry County, where we have a great bit of membership, 29 lowest cost silver plan was $60.93. They qualified for a zero bronze at the 150% of federal poverty level. Their 2020 lowest cost silver plan goes up about $20 to $80.56, but they still are eligible for that zero premium bronze. The Centene second lowest cost member is $64.32. So it's about a difference of $20. Their network is very limited in Horry County as well. Do they want to travel that far to go find a doctor that will be assigned to them if not chosen for them? Remember, they are an HMO carrier. So with limited networks and having to be assigned specific doctors, if you do not choose one yourself can be a headache for members. And they are not used to that type of care because since Blue Cross has been in the ACA market, they have not made you choose a particular primary care provider. You could go to any provider in network of your choosing. Let's go down to the 55-year-old. We still have the zero premium bronze available from 150 to 250% of federal poverty level. And as you can see, the difference in the silver plans is very minimal. You go from $58 to $64. 127. You go from $100 to $64. It is about a $40 difference right there. But again, network assets. network access, difference in benefits, different in tier drug coverage. That is what you're really going to have to educate your clients on when they are thinking of possibly moving. And they can always go from a silver plan to the bronze 4 with a 0 premium in those areas. Have primary care copays, specialist copays, have drug coverage. I mean, so there are many options for them to still access the healthcare providers that they are accustomed to. Some selling strategies. We as the marketing reps and our senior management, we go out all throughout the year and we talk to our agents. Not only, we talk about Medicare, we talk about Medicare Advantage, and we always talk about ACA because, hey, we knew that we were not going to be the only competitor in the field, forever. So we always wanted to listen to our agents to make it the easiest process for them. Because let's face it, middle of AEP now, we're about to start OEP on Friday. That is a lot to do in a little time frame. So one of the things that we've heard, like, how can we help you get more sales? Excuse me. Had to get a sip of water there. But we want more sales. We just do not have time to go out and actively get them. Well, our senior management, we sent all our notes up, and our senior management decided, hey, this year we are going to offer a renewal line for our agents. What does that mean? We are going to be sending you out. We're going to send it to Messer, and we are going to send it to you personally. We just got the file that has the correct APTC amount, what their 2020 rate plan will be, what their difference is from their last year's premium, and it'll give you suggestions on where you can move your members within Blue. What we are encouraging agents, and I'm mentioning that and leading to, the renewal line. It is an option where you can take that list and you see your first 40 clients, and they have a 10-cent, difference in their premium for 2019 versus 2020. You can send a list of those who have slightly to no plan increase, and BlueCross will actively reach out to those members, and they will renew the plan for the member, and the agent will remain the agent on file. So BlueCross has a whole entire team in the Columbia office, yes, South Carolina native, that will be fielding and outbounding these calls per the request of the agent. And we will renew these policies, and we will keep the agent on the plan as well as pay the agent their commissions as earned. Also, the renewal line will be mentioned in our renewal packets that are going out this week. It says in the letter, thank you for being Blue. Please contact the renewal line or your local agent with the agent information to make any changes for your plan, whether income, whether dependent size, and BlueCross will make those changes for you, or they can contact the agent. One way to monitor that is in our basis profile, where you can search all of your database and all of your clients. You can go through, and we are adding a column in basis. And if anyone has questions on this, you can contact me or your marketing rep after the call. And again, I have a map with that at the end. But in basis, there will be a column at the end that says P for passive, meaning they have done nothing with their plan, and A for active. Active would mean that the plan has been touched, that they have actively renewed, and they are good to go for 2020. They do not have to actively re-enroll. Passive is fine, we are just encouraging agents to reach out to those that they see in their file that have a P, just to touch base with them so they can retain their business. Just say, hey, are there no changes? If there's no changes, that's good. I just want to make sure that that you're good to go for 2020, just as a customer service piece, because you all know that agents are out hunting this business this time of year, and that is a good way for you to touch base and just say, I'm here for you if you need anything. But again, this renewal line is being offered free of charge, and the agents will remain the agents on the policy. Again, on that list of members that we will be sending out to you guys, it gives the BlueCross recommendation, and also it'll also give examples of premiums versus out-of-pocket differences. We do have the second lowest silver in several counties, as you guys saw, to include Lexington Medical, where we did gain the Lexington Medical Hospital. So that is going to be a great area for membership growth. And then, of course, the 14 counties where we are the only competitor, we still have the zero premium bronze, guys. And that plan is, it's a true major medical plan. It has the co-pays built in. Again, that was our fastest growing plan last year. And that's because so many of the uninsured who couldn't afford premium now had coverage without having to pay a monthly cost. Also, one thing to point out for 2020, we've seen an uptick in short-term health. We have a great new short-term health plan out there, but it truly is not considered a qualified health plan. And of course, it doesn't cover pre-existing conditions. There's the pre-ex clause on our short-term medical plan. Well, we will be sending out a list of short-term medical clients that you have that you should look. If they're age 30, look, or if they're not age 30, but for this example's purposes, if they are age 30, our catastrophic plan is so competitively priced, not to mention that it has built-in primary care physician services in that plan. So you need to quote that for those 30-year-olds. Also, pay attention when you're renewing and selling, pay attention to federal poverty level, because the further down the federal poverty level that you get, the less difference in silver premiums that you will see in some of these counties. So, pay attention to all of those factors when looking to renew and to grow new business. Here's what I've been talking about. We're going back to the days of where you really had to compare plan designs. I mean, if you look at this example, this is one of our competitors. I'm not going to say which one, but this is one that thinks that this is going to be one of their most popular plans. Okay, and as you saw in several of the counties, there may be a $20 difference in premium or a $15 difference in premium. First, let's point out the deductible. Yes, for individual, it's $400 difference in the deductible. The out-of-pocket maximum right there is $650 difference. Is that alone going to make up the difference in premium? So you're going to have those conversations as well with your agent. Look at the difference in primary care copay, specialist copay, urgent care. I mean, maybe not urgent care, but primary care and specialist, those differences are huge. But one of the most utilized benefits for anyone who has health insurance is prescription drug coverage. Okay, we've got RX generic coverage on both, and we have RX brand coverage on both as well. But if you look at this, if you have a brand name drug, it's $45. With the competitor plan, the member pays 40% of the cost of that brand medication after they meet the deductible. Again, that's after they meet that $6,800 deductible. So for tier 2 or RX brand drugs, you're paying 40% of all your drug costs after the deductible is met. So you're going to have to meet the deductible before you even get into co-insurance levels there. So, I mean, a lot of this is going to be, again, like the old days of health insurance. For any of you who are back there with me, 15 plus years ago, you're going to have to really, yes, this one's $10 less expensive, but this is what it really means. This is the worst case scenario, what's going to have to come out of your pocket. And this, when you go to get that drug, because on average, every member gets one drug per month, for 12 months, this is the difference in premium. So there's going to be some educating on your part. And our renewal line will be asking the questions about medications to make sure their medications are covered. They will be asking the questions about providers to make sure their providers are listed. But you're also going to have to research the drugs with your competitors as well as BlueCross. And you're also going to have to research the providers, because what good is a policy if you can't use it? Okay, some of the selling strategies that we have come up with, and guys, this isn't going to be 2 hours. Jeff just wanted to give me plenty of time to answer questions, and if I can't answer the questions, I of course will take them back and get answers for you guys. But it's just a brief overview of how the rates are changing around the state based on the other carriers. But on exchange, you still will have the ability to offer 0 premium bronze. That's where we saw the most membership growth last year. And some people, after open enrollment, even came up to me personally and said, I didn't know you could get a policy for 0, for a 0 premium. That's unheard of. Nothing's for free. And then I explained to them how it works, how subsidies work, and they're like, well, next year, I'm not missing open enrollment. So there is still the 0 premium bronze option. Look at all your plan differentiations. Yes, a silver plan with another carrier may be, $67 and ours may be $80. But does that silver plan have their doctors in network? Does that silver plan, have good drug coverage on the plan versus, BlueCross? And if they don't want to pay the difference in premium, you can still see your provider by moving them to a bronze plan. I also want to point out, if you're looking at your competitors, because I know a lot of you have, contracted with other carriers, not all of the cost-sharing silver plans are the same. So you need to compare with those deductibles, out-of-pocket, co-insurance levels. All of this is key for a successful 2020. You need to look at out-of-pocket exposure versus premium savings. Just like in the example I just showed you, all of that exposure for brand name medications, you're going to be meeting that out of pocket. Whereas with Blue, if you're just getting your brand medications at $45, it's a good possibility you'll never reach your maximum out of pocket. Another point, and we do still have members on off exchange or the private marketplace, and I just want to remind you guys that BlueCross, Blue Choice, and Bright Health are the only 3 carriers for 2020 who offer off-exchange private plans. We have silvers 15 through 28, which mirror silver plan 1 through 14 on the federal marketplace, with the exception of the ambulatory surgical center copay. With the on exchange is $500 for the ambulatory surgical center copay, And off exchange, it's $525 copay. Remember, those silver rates off exchange are 25% less expensive than the ones on exchange. And guys, there are still some individuals who do not receive subsidy who are on silver 1 through 14 who need to be moved to silvers 15 through 28 to save 28% in premium. I mean, you would be their best friend if you found those guys who are on those plans. And let's face it, due to the premiums increasing so much in some of the counties, members just aren't going to be able to afford the increased difference in Florence and Marion and in some of the other areas, based on what rates have been filed that have affected subsidy amounts. So there is the option of short-term health, and Blue Cross has a great short-term health product out there. It utilizes our PPO network in the state of South Carolina. It's got built-in copays. It's got discounted prescriptions. It's got preventative services. So it is a good option if you simply just can't afford an ACA plan. So there's several options out there for you to offer your clients, for 2020. Selling features of Blue Cross. Why sell Blue? And we preach this a lot, just because we're proud of it. We're local. We're from South Carolina. We have been on the ACA market since the beginning. There have been carriers that have come and gone, some that have left early and didn't pay commissions to the agents who work so hard to earn them. We have paid our agents commissions from the beginning. We are the only EPO carrier on the exchange. So what that means, just as a reminder, is the other HMO carriers, you can't go, if the hospital is not in the network, you can't go to that hospital. If you don't pick a primary care provider, one will be appointed to you, similar to the Medicaid model. And they can't change those for 30 days. We are in every county. We are in every hospital. So you're not going to have members calling you saying, what? My doctor in network. You sold me this insurance. With Blue Cross, we have every hospital in the state in network. Largest network of doctors. We have a very, very expansive formulary. Similar to Medicare Advantage, I said this earlier about drug formularies. It is going to be a service that you are going to need to provide to your members to look up those medications. Because if they are on some medications and they're not on the formulary with the other carriers, they're not covered. Again, we're a South Carolina company. When you call in with issues, when you call in to get an ID card, when you call in to have a claims question, you are calling a South Carolinian. We are the only we are the highest ranked Blue Cross across the nation with an AM Best A+ rating. We have award-winning customer service. Might I add earlier, there is a carrier with customer service of a 1-star rating. So keep that in mind. We have local field reps who, like I said, are out on the road every day of the week, open enrollment, to stop in, help you with any training issues, help bring you supplies, help do whatever we can to help you have a successful 2020. We also offer the Blue Rewards program. That program was a $150 benefit that members who are Blue, they would enroll in the program. They would get $30 for registering, just simply registering for Blue Care on Demand. They would get $60 loaded to that card for a flu shot, and they would get $60 loaded to that card for a wellness exam. All of that once you register for the Blue Reward, and there is a flyer that I can distribute to anyone, and it's also out on storefront. You register with Blue Rewards. That card automatically then loads the services that you have completed. And you keep that $150 and can spend it on medical expenses. Last year, Blue Cross said we would not allow any rollover. That has changed. We are now allowing a $60 rollover to 2020. And that's not just on the card, it's per member on the card. So if you have a family of 4, they have the potential of getting $600. If they did not utilize any of those benefits, they can now roll over $240 for 2020 to utilize on medical services. We also have our program that's Blue 365. It's like the Groupon of health insurance. It's got discounts to gym memberships. It's got discounts on dentures. We also offer, I know most people in the ACA market don't need hearing aids or admit that they need hearing aids, but we also a true hearing discount, which is tremendous. It's up to 50% off hearing aids. You can get free hearing exam, 3 free fittings, 45-day return, no questions asked, 3-year warranty. So, there's a ton of value-added benefits with Blue just for being a Blue member at no additional charge. So while I know there's going to be a lot more, work that we're going to have to look up drugs and search providers, I think that now is more of an important time than ever to partner with Blue and sell all of these pieces and show them where their doctors are in network and show them what their medications are going to cost. But I look to this being another successful 2020 open enrollment. And this is my last slide, and then we'll open it up for questions. And if you can't see this, I can email you a more legible copy of this. Or if you went to our agent seminars, this is located in your agent reference guide. This is where I had to snip it out from when I was developing this presentation kind of last minute, because we've been on the road and all this is somewhat new to us. But Matt Nichols is in the low country up towards the Midlands, Lexington, Calhoun area. Then you've got me in the pink area, and I do a lot of North Carolina. I share Richland with Matt, and my number is below. Then on the upstate, we have Katie Galloway. And then in the Myrtle Beach, Coastal Plain region, up to Marlboro, Lee, Sumter, we have Stacy Funderburk. And all marketing reps are willing to help. I know everyone has asked for me, and I've asked for them. During this busy time, the best way to get in touch with any of us is by our cell phone. Because we are constantly out on the road in appointments. We'll take text, we'll take email, 911, this is Bob, I need you, and we will call you immediately, as soon as we can when we get out an appointment, if that's a text you want to send. We know how busy you guys are this year, and we know how busy we are, and we want to be there to serve you in the best way possible. As I know Messer Financial is as well. They're out in the field. They've got all their great customer service team, and I know that they are willing to help make this a successful time as we are. So again, commissions, same as usual. We are paying SEPs now, thank goodness. So a lot of things are coming for 2020, and I appreciate all that each and every one of you do, and I'm going to open it up for questions now.
All right, Missy, thank you for that. One of the first questions we had in, do you recommend using the renewal line versus the agent themselves doing all that extra work to renew their customers? How would you handle that?
Jeff, what I've been seeing around the state when, talking in our conference calls with other marketing reps and talking with some of my agents. A lot of agents, first of all, yes, I do recommend the renewal line. They will in their letter have the option to call that renewal number or call their agent. But if the agent is asking, how should I let Blue Cross proactively renew my clients, my answer to you is, for those that have not a significant difference in premium from this year and last year, say they have a difference, and in this spreadsheet that we're sending you, it'll show you what their difference in premium is going to be. Those that are, $30 and less disruption, have Blue Cross actively reach out to those members on the agent's behalf. And then I would say maybe the agent reach out to those that are having such a larger impact due to subsidies changing, particularly in the Marion and Florence areas. But again, we're going to send out that spreadsheet to you guys, to you, Kason, and to each agent individually. And I'm going to begin working on that this afternoon because I just got the file. And I would just take the one that won't see much difference in premium from this year and last year, because they're going to have the best network with Blue Cross. They're going to have the more expansive formulary. And let Blue Cross, outreach to those members. I know some agents don't want Blue Cross to touch any of their members, and that's fine too. They don't have to use the renewal line, but we're just doing it as an option to help you guys out.
Okay, awesome. Can you go back over a little bit about the value-added benefits for what you guys are going to offer this year? And do you guys have a cheat sheet somewhere that we can access that for the agents and get that out to them so they've got that readily available when they do meet with their customers?
Yes, we have that. It is at corporate communications. I should have that flyer to you, if not this afternoon, Jeff. I will have it in the morning. They had to do logos and all of that thing, but I will get that to you. Value adds are very important. Like I went over the Blue Rewards, Blue 365. We have discounted memberships. We have every county, every hospital, largest network of doctors, most expansive formulary, and all of those benefits will be listed on that cheat sheet that we will have. And guys, we also, if you don't have your brochure, it's out on storefront, but we also have in the front of our brochure the value-added benefits, such as fitness center membership, weight management, allergy relief, alternative health care, laser vision correction. You can get that done at 50% off and more. Hearing care, hair restoration, I mean, you name it, there is a ton out there. And I can also send you the True Hearing flyer, which is great to show members too.
Okay. Got another question for you.
Okay.
In the event that maybe there's a drug that doesn't show up correctly, or there's a question about how it's handled inside the formulary, is there an exception process that an agent could apply to help a member with Blue Cross, and how would they handle that?
Yes, there is an exception. It's a formulary exception, and the doctor will need to write a note on the member's behalf, and they can submit that for a formulary exception either to their marketing representative, and they can get it to the appropriate area, or they can always submit questions and exceptions. And this is the general mailbox, and they're kind of like the postal carrier for Blue Cross and emails. You can send that to Blue SC inquiries at bcdssc.com.
Awesome. So guys, just as a reminder, this year, as Missy mentioned earlier, we've kind of been spoiled in South Carolina as Blue Cross has been the dominant carrier. We had some folks come in and leave rather quickly within a year or two. So we really haven't had to do some of this extensive work on our appointments, similar to what we do every day with Medicare, where you are having to look up particular doctors or how medications are handled. So just make sure that you give yourself enough time with your clients this year to touch on those things so that you can make sure that they understand what the true cost of the insurance is going to be. Far too often, as we've moved through this industry, both on the under and over 65 side, we've all begun to gravitate towards zero this and zero that without ever really stopping to do some calculations with the member on what it could look like given some situations with their health, what the cost would be. So take a few minutes and work through that with them. You'll be able to show them the value of Blue Cross, and obviously they have the winning name and the reputation in the state of South Carolina. And you always want to make sure that you're adhering to your fiduciary responsibility for your clients. Missy, have you got anything else you'd like to add for us?
No, sir. I just want to thank everybody. I appreciate all that you guys do. I know this is our busy time of year. We're here to help. Messer's here to help. If you're having any difficulty ordering any supplies, anything like that, if you got the agent reference guide at our meetings, there is an insert in there that can help you order supplies. If you still have difficulty, call your marketing rep. I'm happy to help there. And again, we're ready for 2020, and we're excited to be out in the market once again. We've been there every year, and we're here to stay.
Awesome. So, guys, in the next few days, obviously, we're going to be getting a lot of information from both Messer and Blue Cross directly. Make sure that you check your emails, check your spam file, as some of these things with attachments tend to go there these days, and make sure that you're prepared. Let your clients know that you'll be talking to them very soon, but you want to make sure that you've got all the information that you need to do right by them. If I'm not mistaken, Messer's under 65 MyMFG should be showing 2020 rates, and you should be able to do some quoting there. Call into our producer support to get some direction with that. Again, that number is 866-568-9649. And hope you guys have a safe day out there. The weather's a little bit questionable today, but be safe as you travel. Do your best, and we appreciate Blue Cross and everything they do for us. Again, if you have questions, give us a call at your office, and thank you for your time. I think that'll do it today. Thank you.